But I do know that there's some promising research that Johns Hopkins has done in recent years on psychedelics to treat, like I mentioned, also PTSD or anxiety-related issues, if I remember that correctly. So I think that the science, the validity that we talked about earlier about the science, I think that looks to be promising. And this is an area that warrants further research. And so I think there's something there already that I'm sure therapists will take note of. Now, the other issues that we raised about legality and financial compensation, people are going to be worried about that. If they're not in a state where it can be legally prescribed, or where they can get reimbursement for it through their payers, then they're going to be reluctant at best, and probably just standoffish to proceed with that. But I think what's interesting here, I think the other item that we talked about, the fourth area about kind of change in science is culture. And we might really see shifts in culture and patients. If it works as well as some of the studies show, and patients have run out of options in other areas with traditional therapy modalities, then they might be very eager to do so and actually approach their therapists. And that can change the dynamic. And sometimes that can go remarkably quick. Sometimes it takes much longer than one would want or expect. But I think the cultural aspect is probably the most interesting one here to see how that develops.